Starting. Okay, I think I'm going to go ahead and start. We've kind of slowed down a little bit, but hopefully we won't have a bunch of people come in really late and be lost. Hopefully we'll be able to catch them up if they do. My name is Monica Stampley, and I am the Community Outreach Specialist for Early Steps. And I also have Latanzia Montgomery here. She works with Families Helping Families as well. We're with Families Helping Families Region 7, which is Northwest Louisiana. Latanzia, you want to say hi?
Hi, guys. Glad to be here.
Yeah. So today we have some special guests, and I really do appreciate them taking the time to do this today. We have My Place Louisiana. We have Krista Tipton, Heather Alton, and Michelle Cifrio. And they are going to give us more information about the My Place program, and then also things that some of the supports that they provide for families and how they can help families, especially those transitioning from other placement settings. So I will say that throughout the presentation, it's very informal. I say everybody can roll with the flow here. We do want you, if you have a question that comes up, we do encourage you to put that question in the chat. And we will try, if we don't get to your question within our little breaks that we're going to kind of build in, then we'll try to do it at the end. But feel free, no question is a bad question. So but if you do have a question, put those in the chat. And then also there is a survey, and I'll say this again at the end, but I like to say it more than once. We can give you a certificate for your participation today, but you do have to fill out our survey. But it's all good because, the surveys are good. It's letting us know if we're doing what we, if we're doing things right. It lets us know if there's any topics that you may want, or other than My Place, if there's any other information or workshops that we can do. So we encourage you to fill out that survey, even if you don't have a certificate, to help us. And then also it lets our programs that we work for, it lets them know that we're doing a good job or a bad job, and that's okay. So without further ado, I will hand it over to Krista. And thank you again for being here today, and let's get going.
Hey, good morning, everybody. I'm Krista up here at the top. So, well, I don't know if I'm on your screen at the top. So I'll get started right away. If we can go to the next slide. We've had numerous questions about My Place, so I appreciate the opportunity to talk a little bit about who we are and what we do, and I'll try to be quick on the historical information. So I'm going to turn my video off just because it's easier for me to blab without my video on. So, so I'll turn that off for just a minute. So what is My Place? It's basically the Louisiana name for the Money Follows the Person rebalancing demonstration. And I often joke, everybody needs to say that 3 times fast and see how we do, because that's just a lot of words. But basically, it's, in simple terms, it allows the money to follow the person. So the Medicaid dollars can follow that individual to choose where they want to live. So rather than only being relegated to living in an institution and have Medicaid cover that, they can choose to move into the community with waiver services. So it just provides more choices on where they live and what services they receive. So that's it in a nutshell. And then this My Place assistance is provided for during the planning phase. So during the waiver planning, our coordinators are available to assist in locating additional resources, or just brainstorming, trying to break down barriers. That's one of the main purposes of this grant, is to try to address barriers in the state. And so we're there to assist. We do not try to take over. We try to keep that system in place that's already established long before we came along. So we're there to assist in the planning, the transition, and 1 year post-transition. So if an individual moves today, then they have access to My Place supports until 9/23 of 23. So, and the reason that I say supports is because we offer supports, not services. And I've often had folks say, how's a My Place waiver different? Or what My Place services do you all provide? And I have to clarify that we do not have separate My Place waivers. And that's one of the reasons that Louisiana was able to get off the ground and get this grant rolling so quickly once it was approved, because we decided to use existing state waivers. So we didn't reinvent the wheel. Louisiana already had waiver systems in place. They're already very well equipped and experienced in using those waivers to transition folks to the community. So we just picked up using those waivers. And some examples of those are the Children's Choice Waiver, the Residential Options Waiver, and the New Opportunities Waivers. So for kids under the age of 19, well, I say kids, teenagers, anyone under the age 19, they would be offered a Children's Choice Waiver. And then the adults, it's the Residential Options Waiver or the New Opportunities Waiver, just depending on what their support needs are. Okay, so eligibility criteria. In order to be eligible, you have to first be Medicaid eligible, and that has to be prior to discharge from the hospital. So sometimes I'll get a referral for babies whose families, they're not Medicaid eligible yet. So what I'll do is encourage them to go through Social Security in order to get that Social Security approved, because in the state of Louisiana, when a baby is picked up or approved for Social Security, they're automatically picked up in the Louisiana Medicaid system. So that's kind of the process that we take for the folks who have private insurance and are trying to get Medicaid eligibility. And so we have to do that prior to discharge from the hospital. So Medicaid eligibility. Also, they have to be living currently in a qualified institution. That could be a nursing facility, a hospital, acute care hospital, rehab hospital, or an intermediate care facility for folks with developmental disabilities. So 60 days, but that can be a combined 60 days. It does not have to be at one facility. So if, someone goes through has a traumatic brain injury or is in a car accident and they're taken to an acute care hospital, but then they're doing well, and then they get transferred to a rehab hospital for a few weeks before they go home. All of those days count, just as long as there's no break in service. They don't go home anytime in between. So, and then they must also be eligible for OCDD services. And what that means is they have to be approved or have a statement of approval with OCDD prior to age 22. And for the babies who are under age 3, that is their early steps approval. So their early steps statement of approval serves as their OCDD statement of approval until age 3, when they're referred to their local LGE and assessed for services at that time. So we'll take a little minute here. Heather, you have something to add?
Yeah, so I just wanted to say that everyone, I put in a flyer in the chat box, so you can review that. You can download that and keep that double-sided. Kind of goes over some of the stuff that Krista mentioned in an overview to help you keep track of all of those things. Also, we wanted to know a little bit about all of you. So we are going to launch just a quick poll to just find out one question, one poll to find out a little bit about who is here and what your roles are. And you can notice that you can pick more than one answer.
Cool.
And so we're going to give it probably about 30 seconds just to make sure everyone has a chance to participate. Okay, we have about 60% participation.
Wow, that's good.
Great job. Everyone's doing a great job of inputting some information there. We'll give you another 15 seconds to submit. And then we'll share this as well. All right. So on your screen, you should be able to see the results. So we have a lot of early intervention specialists, healthcare, social services, and case management. Early intervention and healthcare are top here in the group. Social services, parent of children with disabilities, families, caregivers, advocates. And then we have the majority of individuals at nonprofit or government institutions that responded to the poll. So for the most part, we have a lot of professionals, which is what we expected in this webinar. So great. Just another reminder, feel free to put any questions that you have as we're going over information in the chat box. I will be monitoring those, and then we can go over those details as our time goes on. So I'll hand it back to Krista. Thanks so much.
Okay, we can go to the next slide, Monica. Okay, so as I mentioned, I need to turn that off. Okay, as I mentioned, the statement of approval for early steps is the OCDD statement of approval for the children under age 3. And so the process is a little bit different because we ran into this years ago when we first started all of this, and Brenda and I worked out this process. So for instance, you may have a child who is currently living at Children's Hospital in New Orleans, but their region is Region 7, their home region. So that is just difficult geographically, just for the early step staff members to get to the family, complete that assessment or that evaluation for services. So what we do is Brenda will review and approve the statement, or write the statement of approval for those babies and sign off on that. And that serves as their OCDD statement of approval, because we have to have that prior to discharge from the hospital. So that was just creating an issue, like how do we get this done before they leave the hospital when they're not home for the local staff members to visit. So Brenda signs off on that. And then once they move home, then the local early step staff complete their customary process. You know, they'll go out and visit with the family and complete their evaluation, and the therapists make their recommendations and move forward from there. So it is a little bit of a different process, but that was just what we decided on with just some of the barriers that we had to address back then. So for the children, that's their statement of approval. And I'd like to point out a couple of things here. And first is that My Place is the only route for children under the age of 3 to get a children's choice waiver. That's the only way. And we've had that question numerous times from case managers, like, how is this baby getting this waiver? I've never had anybody this young, you know? And so, so another question came up from that. And that's my second point, is that these babies are not taking waivers from other folks who have been waiting on the registry. So they're not bumping anyone by getting these waivers. These were waivers that were set aside that the legislature had approved to offer these children in order to basically intervene early and to provide services to keep them. What we were finding is that some of the babies that were being placed in nursing facilities, it was because they didn't have adequate services in the community for their families to take them home. And so that, because initially when My Place first started, it was a 6-month stay. So then we got that reduced to 90 days, and then now it's 60 days. So it just allows us to circumvent that. So rather than the baby having to go to a nursing facility, we're able to move them straight from the hospital home with families with the supports that they need. So, but we're not taking supports from anyone else. And then if at age 3, when they are reassessed by their local LGE, if they're doing fantastic and they no longer qualify for services, then their children's choice waiver would be closed. And like I explained to families, look, if that happens, that's a good thing, you know, because they're like, oh, we don't want to lose our services. Like, look, if they don't qualify, that's good. That means that they've progressed, they're doing forward. And that means that the early intervention did exactly what it was supposed to do. And we see that with Early Steps is such a fantastic program, and we cover the whole state. So y'all, I have visited and been a part of Early Steps therapeutic services in just about every region in this state. And it's great everywhere. I love to compliment the Early Steps therapists because they're all very professional, but more than being professional, I love that they take the time to show mom and dad how to do some of those things. And so it's not like, okay, we can only go to this therapeutic setting and use this really expensive therapy equipment. You know, they show parents how to use a pool noodle to get their baby crawling. I mean, just little things from the dollar store, you know, hey, you can use this. And so it's just really innovative, some of the items that they use. And it's really neat to see these babies come along, you know. So, okay, so I'm getting off on Early Steps. So let me just move forward. I guess we can move on to, again, I'm just going to state that the Children's Choice waiver is the one that is offered to children under the age of 19. And in order to get that person referred, you can either make that referral directly to me, and our email is provided at the end, or you can send it to the general email, OCDD MFP email. Either way, we'll get that. And My Place Transition Assistance, which we mentioned earlier, some of those supports that's available for the first year. It's not just assistance in addressing barriers and planning, but it's also access to supplemental grant funds that we have. And so we're able to purchase things just to help enhance that quality of life and just make things easier. I mean, some of the things that we purchase are double strollers, stroller wagons. I mean, when you're moving around a hospital, seeing one specialist or another, and then you have to get back in the car and go to another appointment. Some of these families have so many different specialist appointments, and you're hauling ventilator equipment, a portable trach suction, oxygen. It's just difficult to fit all of that in just a regular stroller. So we're able to purchase some of those items to just try to help make it easier for some of these families. And portable generators to power equipment during power outages. You know, we have lots of those around here, plenty of hurricane events. And so those are some of the things that we provide. Electrical carts, just a cart with the electrical panel on it. So it just provides more mobility in their homes to move about and enjoy more family time and not be relegated to one room. Cribs, air purifiers to keep the air clean. We do therapy mats so that when the Early Steps therapists are there, or if mom wants to take some time with the baby, they can get on the floor and they've got a nice mat to just do that therapy. So those are just some of the items, and it's different for every baby. Not every person gets the same thing because everyone's house is different, everyone's family dynamic. So sometimes we will do supplements that are not covered by insurance, MCT oil, thickeners, different things like that, extra trach supplies. Sometimes they only get a certain number of trach ties per month that's covered by their insurance. And so we will supplement and provide extras. So those are just some different things, car seats. But as I said, what I always tell families is, look, make that request. And some of the Early Steps folks, as they're going throughout that first year, they will make recommendations for different activity centers or the exercise ball or things like that. And I'll just say, look, we don't know if we can get it approved if you don't let us know that you need it. So let us know what you need and we'll ask for it. So that's how we go about things with the babies. That's some of the items that we purchase for them, some of those extras. And I guess that's about it. So we'll move on to adult services, unless anyone has anything to add.
There aren't any questions so far, but I did put a link for everyone about Children's Choice waivers, just in case you needed that link as quick reference. Yeah.
Good. Okay, good deal. Okay, so for the adult supports, as I mentioned earlier, the waivers are the new opportunities waiver, the residential options waivers. Now those folks will already be linked to those before their My Place sign up with My Place. It's kind of a different system. So with the babies, we get the referrals and sign them up for My Place and then get them linked to a Children's choice waiver, because My Place is their only access to the children's choice waiver. However, with the adults, they're already offered the waiver. So that works a little bit different for them. And so when you want to make that referral for the adults, you can make that to our general email, or you can send that to Heather or Michelle. And I'm going to let one of them, or maybe both of them, kind of walk you through a few of the My Place transition assistance items or services, supports that they provide for the adults.
Well, Heather has just given y'all in the chat the info for the now waiver and the row waiver. And I do want to say, don't feel like you have to wait until you actually have the now or the row with your participant to feel like you need to reach out to us. If y'all have already gotten that process started, feel free to reach out to us and let us know, hey, I'm trying to link this participant to the now or the row, and we would like to look into the option of a My Place as well. But
yeah, that's good. That's good. Yeah, even when they're linked to the supports waiver, the planning phase and the My Place assistance can start even with the supports waiver.
Mhm.
And I tell that to my discharge planners. I'm glad you said that, Michelle, because that helped me remember something. Some of our case managers at the hospitals, what I always tell them is, look, if you have a baby that's at day 45, but you know the family still has to do their ventilator training, which takes a couple of weeks, and trach training, and then they're going to have to do their room in over the weekend. Those, you know, that those days are going to add up to 60. Don't wait until day 60 to make the referral. Make that referral at day 45. If you know that they have an upcoming surgery, so we know they're going to be here. So we can't move them until day 61, but we can enroll them. So that's something that we don't want to wait, because it does take some time to get all of that started. I have to request permission to offer the waiver, get the linkage and the freedom of choice, get them signed up, get that resubmitted, and then them get linked. So all of that, as you well know how bureaucracy works, that takes time. So the earlier we get that referral, the better. And the same with Heather and Michelle, giving them as much time to help participate in some of the planning phase.
Yeah, so, you know, in a nutshell, My Place really is, we're called a demonstration grant program, which really means that we have this flexibility to think outside the box with helping people to move into home and community-based settings that other pots of money and other services and supports don't typically cover, right? A lot of those things are very, very specific and regimented, and there's a list of things that are approved or not approved. But as Krista mentioned, one of the things that we really pride ourselves in is working with all of you as team members in the transition planning process to really assess a person's needs and figure out how we can come together to really improve that person's quality of life when they move into the community, and to give them the best chance at success that they have. And so just one story that I'd like to share that gives you a tangible example of kind of that transition assistance that we offered. And we helped a teenager in Louisiana to move back home, and part of their needs were a lot of coping, right? So there was a lot of emotional dysregulation at play, and multiple diagnoses that were preventing success in social, familial relationships, as well as school success. And so we actually ended up purchasing art supplies for this person because those art supplies were their way of coping, of processing the feelings and even the schoolwork that they worked on in class. We worked with the teams at their school over that 365 days as well, in helping them to ensure that those needs were met. And we had also helped with the transition process of transitioning that person back into their home as well after being institutionalized. So we're involved in a lot of different processes, and that's just one example, but we're involved in the planning stages before a person moves into their home. We're involved in actually helping to get those housing applications done and ensuring the teams are operating efficiently and well, and we'll host all the Zooms every month to make sure that the teams are on track. And then once the person moves, we can help buy all of the things that they need. If they're an adults moving in on their own or with roommates, then we can help buy some of those things like toiletries and a bed or a couch or whatever needs to go in the kitchen or washers and dryers. We can help purchase all of those things within our budget. And then we can also purchase those out of the box items that really make or break a difference for people based on their desires. I have another individual that we're helping, and as soon as this person is ready to move into their apartment, we are buying a basketball hoop for them for inside their, like one of those door or wall basketball hoops. And that seems really simple, but that's probably not something that you could get covered from somewhere else. And when individuals are on limited incomes, it can be difficult to justify spending that money. And that's what we're there for. When we found out that this was a way that this person really dealt with stress in the past, it was a no-brainer. We're going to put that on the list of things that we want to make sure that this person has. So those are just small items. And then again, the bigger things to actually helping someone move into the house, but those small items can make a world of a difference for someone, especially when we take the time to work with them on their specific needs. So I hope that helps to contextualize for all of you, giving you some examples of just a couple of ways that we try to work with the teams and think outside the box and explore those ideas. And no idea is a bad idea. And it might be a no, but it might be a yes, and it might make a difference. So yeah. I'll head it back to you, Krista or Michelle.
No, I was just gonna quick little add on there. Like even like I had one participant that was super nervous because he wasn't, he didn't have a job yet. He was relying solely on Social Security, and he was worried about being able to pay his bills and pay for groceries and everything like that in that first month before he even got his job yet. And that's something my place can assist with. If there's room left in the budget, we can pay for that first set of groceries, stock up that kitchen. If the deposit on the bills and everything, like things like that just kind of take a little bit of the burden off of their finances, make a huge difference. But yeah, anything like if y'all think of something, ask, and we can let you know if it's a green light, red light kind of situation. Like, because my place, like Heather said, we can think outside the box, and if it can apply towards that person's well-being now and in the future, it can be justified. So ask. All you got to do is ask, and we can help you out.
Right. Yeah. And it's different for every family, because I've had, and I'll tell my parents, my moms, look, sometimes you're awake at 2 o'clock in the morning because the ventilator went off, or there was beeping, or the baby needed to be suctioned. And so then you're tripping over something, or you're thinking about, man, it would make life so much easier if I had this, or, if I could just get this stuff off the floor, if I had somewhere to store this. Because I don't know if you all have much experience with this, but Medicaid will send so much of some equipment, and oftentimes it will be stuff that they don't even need. Like one mom told me, she said, I have a closet full of this tubing that we don't even use, but I can't get some of this other stuff that I really need. So these parents will like trade stuff. They're like, we don't sell it, we're just trading, But she said, some of it, I really do use, but I just don't use it as quickly as what I'm getting. And so I just need a place to store all of this. So we're able to provide storage, but they may not have space on the ground. So for one mom, I visited and we're looking around, and I'm like, well, look, you've got all this wall space. So would you be okay with putting some shelves on the wall? And she's like, yeah, I never thought of that. So we were able to purchase some of the cubes and put those up on the wall just to kind of get all that stuff up and just allow them to put all, when you have extra drape ties and extra supplies that you need to put in there, the sterile Q-tips, we do the over the door shoe storage. That really works for a lot of the families. And so we put that, and we learned that from a mom. One of the moms was like, oh, let me share with you what really works for us. And it was so great because then we started using that, asking everybody, you want this, So it's just something that it's clear. They can open that door and they see, okay, there's my sterile Q-tips, there's my extra drape ties, there's this. Oh, I need to restock that. And so then they have the little extra drawers that we purchased with some of the storage. They'll pull that out and put it all up right there. So it just makes it easier when you're doing something like that. And then changing the tray ties, that's something, or even changing the trach, whenever they're doing that, it's difficult to kind of get that done while they're down on the ground, mom's having to bend over. Usually it takes two people to do it. And so some of the moms are like, hey, could we get a changing table? I mean, yeah, we'll use it for diaper changes, but it would really be great for trach changes too, because you can get on either side of that. So that's something that works for some families. And then some other families are like, yeah, we don't have room for that. So that's not going to work for us. So it just depends on the person. And I just try to tell them, just if you think of something at 2 o'clock in the morning, text me. I'm not going to respond, but I'll see it the next morning and we'll try to address that and see if we can figure something out, So it's just, again, that out of the box thinking, like Heather said, and things just vary. It varies from family to family and baby to baby. So we just like to try to be there to provide that support and try to help brainstorm and come up with some things. And sometimes, the team does a better job than me at coming up with that. Those early steps therapists are fantastic at coming up with those ideas. So that's another advantage of our program.
I just want to say, I'll quick, I know we have a little pause here. I want to interject because I really want, again, I know I've said this before, I've thanked y'all for being here, but that is exactly, I thank y'all for doing your jobs and just saying, I mean, the ability to think outside the box. I know as a parent of children with special needs and working with families who have kids with special needs, I know that is like one of the most valuable skills that anybody that we work with or that's working with us and our kids can have. So I appreciate that. And even like the list of things and the way you said it, I could tell that that's true. You don't just like go in and do your checklist. You're like, looking at the whole picture and looking at where things can fit in. So I just wanted to interject that because that's so important. And I know I talked to y'all a little bit about how good our state is when it comes to early steps and Office for Citizens for Developmental Disabilities. I want to say that about y'all. Is there another question too? And I didn't even think about asking y'all when we were going through and reviewing stuff, but is there anybody else? Is there another My Place contact in the state that's not on here? Or are y'all the three for all statewide?
Yes, we're the three for statewide. But that general email, the OCDD.MFP, Scott, our program manager, he will review that as well. I mean, he is another part of the program, but he doesn't do the planning and the moving, he's not a transition coordinator, but you can certainly make referrals to him as well.
Okay. I just wanted to know, because I just wanted to let, just say again, how lucky we are, how fortunate we are to have all three of y'all on here and contributing to this and helping us try to understand. So I just want to ask that real quick, but I'm back to you.
I included, sorry, Krista, I included all of our emails in the chat as well. So you have those, and I know that they're going to be on the next screen as well. And then we do have a question whenever you're ready, Krista, because I think it's going to be directed to you.
Okay. I'm ready.
So Pamela Newton, if you want to unmute, or Monica, if you want to unmute Pamela Newton, she says she has a question about My Place babies.
Give me a second here. Let me get in. I'm not as fast as some people may be, but I'm going to unmute you if you're if you're
I
available to talk, Miss Newton. Miss
Okay,
Newton,
hear
there we
me?
go.
We can hear you.
Okay, hello, Krista. Haven't
Hey,
seen
good
you in a
morning.
minute.
Good to have you.
Okay. Yes. Okay, so I have a question. I know we have done it both ways with my place babies. So with the place babies, do they, let me make sure I'm saying it right. Can they have an FSC agency and OCDD? Or will early steps SPO provide services? Will a case management agency provide the services for case management, or will the SPO or early steps?
Okay,
Pamela, you're breaking up a little bit, but I think the
I think-
question, I think the question is, did you get the question?
yes.
Okay.
I think the question, go ahead, Heather.
No, go ahead.
Okay, I think I didn't get all of the extra information. It was breaking up a little bit, but I think the main question is, can they have an early steps agency, the FSC, which is their case manager with early steps, as well as a waiver case manager? And the answer is yes, because some of the regions do not have case management agencies that operate both services. So if they do, like for instance, some of the regions, region 1 and 10, 9, I believe, and 2, they have agencies who provide waiver services as well as early steps, like ABC case management or CRC. So we will encourage families to utilize that if possible, just because it's easier to have it all in one agency, but they are not forced to do that. So for instance, if a baby moves with the ventilator program, so which they're only eligible for if they move home with a ventilator. So VACP provides the case management services, and then they can elect whichever early steps provider they want to use. So yes, they can have both.
Does that by any way increase like the number of meetings or contacts if they did but have both?
It does, it increases, I don't know that it increases, because even if you're working within the same agency, you still have 2 coordinators usually. So because like with ABC, for instance, I have one right now. I was just talking with the case manager yesterday. She oversees the waiver side, but then there's another coordinator that does the early step side. I think it's probably just too much cross training to have the case managers trained in waiver services as well as the early steps. And plus with their participants, many of those will have 30 to 40 participants at a time. So trying to add early steps participants on top of that and meet all of those criteria that you all have, or as far as what the case manager is supposed to do, I don't know that one person could do that. So they do have 2 different ones. But I think it's just easier for the families to remember, okay, ABC, oh yeah, okay, that's early steps, or oh, that's my waiver person. And so, because sometimes with these families, there's so many different people calling them, that they just get confused sometimes. Okay, what are you with? And who are you? What do you do? Oh yeah, I remember you. So it's just easier to have it rolled into one. But I don't know that it necessarily lessens the meetings, probably about the same.
Okay.
Did that answer you, Pamela? Okay, so Heather got that in there.
I don't see any other questions, but we can give a moment in case people do want to ask any questions.
Yes, and you can always email later if you think of something or something presents, feel free.
I will say, I want to make sure that I heard this right. And if you can just kind of maybe give me a little more information or expand on it a little bit. But I heard you say My Place is the only way for under 3 to get a waiver.
Yes,
So
they cannot,
go ahead.
because customarily you are not referred for a statement of approval with the OCDD LGEs until age 3. So they would not get a referral until age 3, which means you can't get a waiver without an OCDD statement of approval, and you can't get a statement of approval until age 3, unless you're My Place. Because what happens is with My Place, we have those set aside waivers that we're able to get them linked to, and they get their early steps statement of approval. And so that just serves for that My Place population as their OCDD SOA. Before that, with any other child who is not My Place eligible, that does not serve as an OCDD statement of approval. It's just their early steps, because you have not everyone who's early steps eligible is also My Place eligible, if that makes sense. And so we can't sign up everybody who has early steps. So in order for us to sign them up, because there was no system built in originally for us to get that statement of approval through OCDD, because again, that doesn't happen until age 3. So that's how we came up with the early steps serving as their statement of approval for the My Place eligible babies. There's no way to get added to the registry or to even get assessed for services, for Children's Choice Waiver services under age 3.
Is there another question? I might be thinking about all kinds of things, but gosh, it dropped right out of my mind as soon as I thought about it. I'll have to come back to you in case.
Taking a page out of my book.
Yeah. Okay, I remember what it is now. And that's sad. It's Friday though. Let me say that again. It's Friday.
Yes. Thank goodness.
Is there like a time frame or a required amount of days that y'all have to complete like intake when you are, because you had mentioned something, you had mentioned that, you know, if you know this kid is still going to be in the hospital or this individual is still going to be here at day 45, that they're still going to be there at day 60, then, you know, go ahead and refer a little early. But you know, what if you are, you know, you're getting a bunch of referrals and it is day 60 and they're about to leave in a week? I mean, what does that look like? How is there a time frame for you know, to complete the total like intake and statement of approval and getting everything done, and as far as eligibility for the program?
No, it's not.
Are you asking
And
like minimum amount of time that we need before they're discharged, before they can go home?
Well, no, I mean, just to find out if they're going to be eligible or not, I would say, or to complete that first step of, you know, because I know, you know, sometimes in each region is kind of different too. You know, I mean, I know, and even within a region, it can vary depending on people's workloads and stuff. But I know sometimes an individual that's not even in any kind of setting, they're already at home, they get a waiver offer, and then there's a long process to go through to get that going, as far as getting the long-term medical certification and, you know, just all the steps that you have to go through to get it done. Does that happen any faster? Or do y'all have any specific timelines that y'all have to adhere to be able to get all that stuff done?
We don't within our program, and it's probably not much difference than what you just said. It varies from region to region. I have some regions that turnaround is, you know, the baby goes home and 30 days later the plan's approved, and we're like, what, how'd that happen, you know? And then I have some where it drags out for a few months for that final approval, which doesn't hurt my families as much, because oftentimes, well, primarily more often than not with our families, they don't really use waiver services other than case management. Very few of them will use provider agency services, because the provider agencies cannot take on the liability of providing services for some of those babies. And what I mean by that is they can have a worker that can come into their home that can help with, washing the baby's clothes and cleaning up around their room, maybe sterilizing some things, but they can't be left alone with the baby because they are not trained to operate the ventilator. They're not trained in trach suctioning, and that's not even a liability that the provider agency wants to take on. So even if I've had in the past a grandmother who was an RN that wanted to work for the provider agency and provide services for her grandchild, and she could not even provide those services while she was on their clock, because if anything were to go wrong, then they would be held liable because she was an employee of them. So often they will just utilize case management. So that children's choice waiver approval not occurring as promptly in some regions as others is not as crucial for some of the babies, because these babies there's babies that leave the hospitals all the time without any My Place, without any children's choice waiver services. They're trained, mom and dad are trained. I kind of was put in my place one time, talking to the hospital staff about this, like, well, we're not going to have this in place. And the case manager said, okay, listen, I'm going to say this as gently as possible, but we've been moving babies home from hospitals with their families long before y'all came along, and without OCDD intervention and without anything else. And they do just fine because mom and dad are trained at this hospital to provide care for them. And I was like, okay, I wasn't trying to say that, sorry about that. But I mean, it's true. They are there to provide that care. But now, does mom need a break? Yeah, she does. And skilled nursing provides that service where if mom did want to work outside the home, then the skilled nursing staff members could stay there with the baby while mom is gone because they are trained to provide that service. So that is a little bit different, but that's not a waiver service. That's provided through state plan. So they have that even if the waiver isn't approved. So
And
does
that's
that make
something
sense?
y'all get in place.
That's something that the hospital makes that referral while they're in the hospital, because you have to have a letter of medical necessity written by the doctor and a prescription. And it's just easier to get that while they're still in the hospital, because once you get home, the mom has to make an appointment with the pediatrician. Sometimes it's a new pediatrician that's never met the baby. So then they have to get to know, okay, what's going on with the baby, review all the records. So there's delays. So the hospital case manager usually takes care of that, makes that referral. So that doesn't, now they may be approved for 84 hours for that week per week when they go home. Well, they may not necessarily get that if there's not a nurse in their area. Some families that move home to rural areas, and there may only be one or two agencies, sometimes no agencies. I have a baby in the north of Monroe area that can't get services because there's not any agencies that provide care. So mom is a nurse, but she can't get paid to provide care. But she also can't work. Like she could go to work somewhere else and another skilled nurse could come provide care for her baby, but she couldn't get paid to provide care for her baby. So, and she can't get a nurse now because of where she lives. So yes, that is normally set up prior to them leaving the hospital, just because it's easier. That physician knows that baby. They can write that letter. Most of the time the nurse writes the letter anyway and just gets the doctor to sign it. So it's just easier to get that done prior to discharge.
That was my next question, was the nurse question, because I know here, and we're not a rural area, even Shreveport Bossier, there have been cases where we have families that don't have skilled nursing, and that's a big issue.
Yeah.
What about getting them into self-direction? Are there any families that can do self-direction?
Yes,
to help kind of fill in
we
those
have
gaps?
families. Yes, we do have families that do self-direction. Some of them just don't want to fool with the paperwork. And then we do have some. I have one family she's working on it right now. And I think her mother and her cousin are going to provide the care. So yes, we do have participants that do that.
And just to clarify, I know that this is an early steps training, so we're focusing a lot on the participants that we help that would fall in that category with early steps. But that process the process and timelines do look a little to a lot different for adults. So some of those processes in the application, the referral, the approval for My Place, and all of that that whole process looks a little bit different. And so we can get a referral at any point in time, and we can start working in that transition planning with an adult who's moving from a facility into their own place. But those processes can take anywhere from 2 days after we get a referral to starting the planning process for what items to purchase for their move into their new unit, or it could be up to a year depending on which hurdles we have to overcome because of housing or worker shortages. And so I just do want to clarify that, and I'm not going to go into those details because I do see that we've had the attendance drop just a couple by a few. And so I think we're kind of nearing that end time. But if people have questions about that process, I just want to say they can email us to get more information on what those processes look like. But really the best answer is email any of us if you have questions. Earlier is always better. I know Early Steps does report on their approval ratings, like they get things approved within X number of days, 99% of the time, and all of those types of things. We're just a different program. Like I can't approve someone, we can't approve someone being a My Place participant until they are bumped to that Now or Row or Children's Choice, the Now or Row waiver for the adults. So, right, we can't do anything until that happens. And sometimes that happens tomorrow, and sometimes that happens 6 months from now. So,
and sorry, Heather, if the participant was on Children's Choice or is on Children's Choice, but they're getting ready because they're Children's Choice, I think they can stay on until 21, 22. And then
19.
The Now or the Row.
Yeah, at 19, once they turn 19, they have to be bumped to an
They
adult
changed
waiver.
that. They changed that when they did system transformation. So they stay unless you have a justification to get off of Children's Choice and go into another waiver. You're on Children's Choice until you're 22.
Oh, cool.
Yeah,
That was on Children's Choice, and he was getting ready to turn 22. So we were trying to get him onto the Row with his with all of his diagnoses and everything. So even if that's the case, like Row and Now, that's me and Heather, we can handle that too. But just wanted to throw that out there.
Yeah, it's very different for the adults and the kids, the timelines, because obviously those things need to be in place for an adult to move home. He's going to need that support, either the IFS or PCA with Children's Choice, whatever. It's basically the same service, but just has different names for it. But they need those IFS hours. They need those folks coming in to help them. So it is definitely very different.
Monica, thanks so much for having us today and for just allowing us this time. And yes, thank you to those who asked questions for those questions as well.
Yeah,
yes.
I put the slide up. We had our own questions for a while, but I put the slide up with y'all's general information. And there is the ocdd.mfp@la.gov, and then I've got the three of y'all's email addresses here. And if somebody doesn't remember this or whatever, they can always contact me here at the office. I am with Region 7. I know we have people from other regions and other areas, and I can always direct you to, and especially if it's something concerning Early Steps, I can definitely direct you to your region that you need to talk to with that. So I hope everybody's had an opportunity to get that. I'm just gonna say a little thing here. This is our contact information. I'm Monica, and I'm the Early Steps Community Outreach Specialist. I'll also do some other projects here at Helping Families Region 7 that we work with children and youth with special healthcare needs. And then Latanzia Montgomery is on also, and she is the family facilitator for Office for Citizens for Developmental Disabilities, and also the education specialist. So we all do a lot of things. So I have on here
A lot of
also
hats.
while I'm talking, because I want to say this before I say some of the other stuff and wrap it up. But please, if you want to take a picture now, pull out your phone, open up the camera, take a picture of the QR code here. This is for your survey. Okay, so like I said, if you need a certificate, the only way you can get a certificate is to put in the comment section of the survey your full name and email address. Now I need your full name because sometimes y'all don't always register with, or might say an initial or something like that. So that's why I want your full name. And then the email address, I need that to make sure I know that I am sending the certificate to the correct place. So, but that has to be put into the comment section of the survey. Don't put it in the chat here because I'm not recording the chat. But go ahead, take the survey. Like I said, the survey is good. It doesn't take very long to complete, and it always, we always welcome feedback too. So, and the feedback too, I can share it with Heather and Krista and Michelle. In case if you want to have anything or let them know anything, then I can always share that with them too. So it's good for everybody to get feedback, and it's good for you to get a certificate, but you got to put your name and your full name and your email address in the comment section of the survey. So our email addresses here for Latanzia and I are on here. Monica.Stampley@la.gov, and Latanzia is lmontgomery@fhfregion and the number 7.com. Our phone number's here. Like I said, we are in Northwest Louisiana. My Place is statewide, and Early Steps is statewide, and OCDD is statewide. But if anybody is in a different region or they're confused, you can always reach out to me. And like I said, I can get you to the appropriate region and who you need to talk to. So another thing is that a part of what Families Helping Families does is we want to educate and support our families that we work with. And, there may be a family that has an individual or has a loved one that is in an institution, and they don't know that there's something like My Place out there that can help them with these things to help transition them out. So that's one reason why we want to do it. We also want the people that work with our families to know about it so that they can give them this information too. So we do a lot of workshops and trainings for families. You can follow us on social media. We're on we're on Facebook. We have videos of the recorded presentations that we've done in the past, and this one should be put on YouTube. So, check out YouTube. We're also on Instagram and LinkedIn. But the main thing is on any of those social media platforms, you just search for Families Helping Families Region 7. That's our specific name. If you search for that, then you should be able to find us. And all of our as far as keeping up with any kind of workshops or upcoming events, those are going to be on Facebook. So I think we did fantastic for a Friday. It's noon now, and that is just awesome. I know we try not to go over an hour. We want to be, we know that your time is valuable, and I know y'all's time is valuable, and I cannot thank you enough for all three of y'all doing this for me today. And I'm going to definitely keep y'all in my contacts information for anything else I may have coming up. I know I've already got Krista set up for something. So I appreciate y'all coming, and everybody have a great weekend. I will pause a second while everybody's kind of leaving out. I'm going to pause and leave this up so I'll have the QR code up. But that's it. We're going to wrap it up. Y'all have a great weekend, and thanks,
Thank
ladies.
you. Thanks, Monica. Take care.
Thanks so much.